I'm sure you've got some questions about what's going on here. Now, this is not cocaine.
The mess has begun.
It is a representation with flour of the amount of cocaine that a guy took after he took the cocaine vaccine.
They had taken probably 10 times the amount that we'd ever seen taken by a living human, so that it probably would have killed them otherwise.
And he didn't feel any effects from it whatsoever.
They effectively said it really didn't produce anything in them.
Now that just shows the power of the cocaine vaccine. In this video, I want to explore what this vaccine is. I want to explore the background of cocaine, how it causes such a huge impact on society, how it can potentially kill you, and how the cocaine vaccine might be the solution we've been looking for. Stick around to the end to learn some healthy habits about how we can manage addiction and how we can apply old technology to new problems. So, let's get into this.
The addict must have his drug. He lives from fix to fix.
Key to success in this racket is this little baby right here. It's called cocaine.
Almost 1 in 10 has cocaine in their system. I love cocaine!
The indigenous people of South America have been using the coca leaf for thousands of years as both a medicine and as a stimulant. It was only when they worked out how to refine it that it became the drug that we know today. Cocaine can be injected, smoked, but it's most commonly sniffed or snorted. In the US, approximately 2.2 million people use cocaine regularly, and in the UK, about 5% of 16 to 24-year-olds use cocaine. I've seen it firsthand at university and festivals and seen just how easy it is for people to pick up the habit and then not be able to put it back down again. Let's have a look at what's happening behind the scenes when you take cocaine. When cocaine enters through your nose, it gets into your bloodstream. From there, it travels up to the brain where it meets the blood-brain barrier. This is the guardian of your brain to stop unwanted toxins from getting in. If your brain was the roadhouse, then this would be the doors with Jake Gyllenhaal or Patrick Swayze standing on them. It's also an essential part of the story, so remember it for later. Cocaine crosses the barrier, and then once within your brain, it doubles the levels of dopamine in some parts of your brain, and in others, it can increase dopamine by 5 times. That obviously depends on how much you take, and of course the area of the brain the cocaine is acting on. The result is a feeling of euphoria, increased confidence and energy, and heightened senses. It also spikes your blood pressure and heart rates as well. While it makes you feel good in the moment, there's a reason it's a Class A drug. Those millions of people taking it on a Saturday night could be sniffing their way to both brain and heart damage. Here's how. On every step of that journey into your brain, cocaine causes damage. Artie Lang is a comedian who abused drugs for 30 years, and it left his nose looking like this. Why? When snorting it, cocaine causes constriction of the blood vessels in your nose, causing reduced oxygen to the tissues, and over time that can cause those tissues to die. It can lead to a hole in your nasal septum or even infections in the bones surrounding your nose. In this case, Artie Lang's septum completely collapsed from all of the damage caused by the cocaine. Your nose is the least of your problems though. Your prefrontal cortex is like the brakes of a car. It keeps your impulses in check and helps you steer your decisions. With chronic use, cocaine can cut the brakes on the prefrontal cortex, and that leaves you driving 100 miles an hour with no way to stop, leading to rash decisions, aggression, and poor attention span. It could help explain Charlie Sheen's bizarre interviews, his obsession with winning, and his impulsive and confrontational discussions.
Good start. It's a good start.
It's a great start.
Yeah, it's the first win.
I win here and I win there. Now what?
Come Wednesday morning, they're going to rename it Charlie Brothers and not Warner Brothers. Duh. Winning.
It's exactly the kind of behavior you'd expect when the prefrontal cortex is damaged. Remember the Blues Brothers? The main guy, John Belushi, this guy right here, had a big issue with cocaine and drugs. He unfortunately died of an overdose of heroin and cocaine. So that raises the question, how can cocaine kill you? In the emergency department, we always ask young people with chest pain whether they take cocaine. Why? Because cocaine can cause your coronary arteries to go into spasm. Those are the arteries that supply your heart, and if they spasm, they can cause heart attacks. To really bring this home, a study of around 9,000 adults published in 2014 found that for regular cocaine users aged 31 years old, their life expectancy was around 10 years shorter than those that didn't take it. Although cocaine causes so much damage, we haven't found a way to help people with cocaine addiction in the same way we have with alcohol, meth, and smoking. But that may be changing. A vaccine is a powerful tool that trains your immune system to recognize and fight off specific viruses or bacteria by introducing a harmless piece of the pathogen. It's like giving your body a sneak peek at the enemy so it knows exactly what to do when the real threat shows up. But can we only use the immune system to fight infections? Scientists have used it to fight cancer with immunotherapy. But what about cocaine use? Because the cocaine isn't alive, so it can't be killed, but it turns out the immune system can stop it. Just not in a way you might think. Dr. Thomas Kosten put this to the test in 2009. He took 115 addicts who attended a methadone clinic, but also used cocaine and other drugs. It was a randomized, double-blind, placebo-controlled trial where 58 participants were given the cocaine vaccine, while 57 were given dummy injections.
The drugs of abuse are way too small to actually produce an antibody response. We have to couple that drug of abuse to a large protein that does produce antibodies. In the case of the cocaine vaccine, we used part of the cholera toxin.
Then, when the body produces antibodies against cholera, it also produces antibodies to cocaine as well. The next time the person takes cocaine, the antibodies bind to it as it enters the bloodstream. Remember the blood-brain barrier from earlier? The cocaine is now bound, so it's too big to cross into the brain. Because of that, it can't exert any of the effects that it did before. So basically, now Jake Gyllenhaal will win the fight with Conor McGregor and keep him at the door. The same thing happens with the heart. So it can't enter the heart tissues to affect them either, so stopping the heart attacks and the coronary vasospasm as well. Why isn't it on the market then? Although the participants in the vaccine group received all 5 shots, only 38% of them developed enough antibodies to block the effect of cocaine. So basically it works, but it's not a particularly good vaccine. What this really shows is a promising new approach to treating addiction. Dr. Kosten's research continues to be built on, although we don't have a full solution yet. It's not just being used for cocaine addiction though, but it's also being used to try to develop vaccines against fentanyl and nicotine as well. While the cocaine vaccine isn't ready to be used clinically, this research shows us that by thinking outside of the box, we can use old technology to solve a huge problem that's impacting society. It leaves us with a void right now though. So how can we fight addiction now? Addiction is the progressive narrowing of the things that bring you pleasure. In the case of cocaine, the biochemical tsunami of dopamine and the subsequent pleasure make it near impossible to match. And because of that huge spike, it can become your only source of pleasure. One of the best insights about managing addiction that we can apply right now came from the strangest place.
This village was a battlefield in the Republic of Vietnam.
The Vietnam War.
The United States Marine Corps.
During the Vietnam War, drug addiction was a massive problem. 20% of US soldiers in Vietnam were addicted to heroin.
These Marines on river patrol are ready to challenge the authority of the Viet Cong.
Knowing how addictive heroin was, it was a huge health concern for when they returned to America. Everybody thought there was going to be a massive heroin epidemic, but there wasn't. Dr. Lee Robbins found that 95% of the soldiers who were addicted in Vietnam stopped using the drugs completely when they returned to America. One of the most important factors that she identified was the power of changing an addict's surroundings as a tool to change their behavior. By taking yourself out of the context where cocaine is rife, it may help to manage the urges to take it. Addiction is very, very complex, and if you need help with it, then please visit your doctor because there are lots of services to support you and we are here to help. While the cocaine vaccine isn't ready for clinical use, research like this is giving us hope that scientific breakthroughs combined with environmental changes could lead to new ways to tackle addiction. I find the creativity and inventiveness of this story very inspiring. The treatment most would have come up with is an antidote to cocaine's effects, but Dr. Kosten had the creativity to take vaccine technology and say, what if this is our answer? How could you grab an old idea or technology and apply it to a completely new problem? If you enjoyed this video, please subscribe and watch this video to find out how fake Ozempic could kill you.